I've used a lot of meal services, but Hungry Root truly stands out because it's built around the way real families live and eat. They don't just send meal kits. They personalize your grocery cart and meal plan based on your preferences and dietary goals. All I had to do was take a short quiz, and right away, their smart cart technology started building a cart that fit how we eat. Now, each week feels easier, like someone else is doing the thinking for me. I've been focused on cleaner eating lately, and I love that Hungry Root keeps out over 200 additives, including things like high fructose corn syrup and artificial sweeteners. Their meats are hormone and antibiotic free, and the produce options include organic and non GMO picks. They also stock brands I already trust, like Oatly, Vital Farms, and Harmless Harvest. One of our favorite meals has been the teriyaki salmon with green beans, light, flavorful, and done in 12 minutes flat. Plus, I've noticed we waste less food, spend less time shopping, and even save money by skipping those impulse grocery buys. Take advantage of this exclusive offer. For a limited time, get 40% off your first box, plus get a free item in every box for life. Go to hungryroot.com/Dr. Meg and use code Dr. Meg. That's hungryroot.com/Dr. Meg. Code Dr. Meg to get 40% off your first box and a free item of your choice for life. hungryroot.com/Dr. Meg. Code Dr. Meg.
On today's episode of Parenting Great Kids.
Bedwetting is more common amongst girls than boys. A lot of parents are embarrassed by it. A lot of parents feel their kids need a psychiatrist. They don't.
Welcome to Parenting Great Kids. Here's your host, Dr. Meg Meeker.
Today I'm going to do something I rarely do. I'm going to talk about regular kid problems that parents deal with. And today I'm going to talk about bedwetting. It's a very common problem, and a lot of parents are embarrassed by it. A lot of parents feel their kids need a psychiatrist. They don't. A lot of parents feel that bedwetting is done intentionally by kids who have an underlying emotional problem, or they're mad at their parents or whatever. Don't make it that complicated. It's not uncommon. And there are some solutions that you can start to do in order to help your child stop the bedwetting. Bedwetting is more common amongst girls than boys. Actually, about 20% of boys who are 5 bedwet, and about 10% at age 7 wet the bed. And of course, it goes down after that. But bedwetting can go into prepubertal age. And so it's really important, if you have a son who's bedwetting, that you know how to handle it. First of all, it is not the child's fault. They're not doing it on purpose. It tends to run in families. Most dads don't want to come forward and say, oh, well, he's bedwetting because I used to bedwet. Again, they feel ashamed to say that. They should never feel ashamed to do that. But it often runs in families. And again, it's important, if dad did bedwet, for him to say, you know what? I used to do the same thing and I outgrew it. So what you need to do, first of all, is don't blame the child. Many kids, even if you say nothing, feel embarrassed. They don't want their friends to find out. Maybe they wear a pull-up at age 5 to bed, or 7 or 8, and they are embarrassed to go to their friend's house for a sleepover. They don't want their sister to know. They're embarrassed when their sheets are wet in the morning. So make sure that your child knows it's not his fault. He can't control it, and there's nothing to blame, and it will go away. And your job as a mom or dad is to help him through it. When he wets the bed, do not make him wash his sheets. He didn't do it on purpose, and making him wash his sheets actually makes him feel a little bit more embarrassed. So don't make a big deal of wetting the bed. Second thing you need to do, make sure you get a good mattress cover that won't let water or urine go into the mattress. That will really help him get over feeling ashamed about it. So why do boys wet the bed? Sometimes it's family history. It's a genetic issue. Some kids are just slower to develop. We know that language-wise and reading-wise, a lot of boys are slower than girls. We know that some kids have a sleep disorder. Some kids just don't wake up. They feel an urge to go to the bathroom, but they can't wake up. They are in such a deep sleep state, again, they didn't choose it, that they just don't wake up. Other things that can cause it, diabetes, urinary tract infection. Sometimes there's stress. And there's also another common problem that boys this age have, constipation. The bowels are very close to the bladder. And if the bowels are filled and pushed out and you've got some poop stuck in the bowels and making it bulge, it rubs up against the bladder and it can cause a urinary tract infection, or it can cause dysfunction of the bladder muscles. So if your child is 5, make sure you take him to the pediatrician first. If he's having bedwetting, have him or her check all these things to go through exactly what I'm going through. Because the last thing you want to do is if your child has an infection or a bladder function problem or has diabetes, those are things that you can really fix. So it's really important for you to do that. The next thing you can do is make sure that you wake your child up before you go to bed and take him to the bathroom. In many situations, this cures the problem. Not only because they empty their bladder for the rest of the night, so they don't wet the bed, but also it teaches kids to learn to get up in a deep sleep state, that when they have an urge to go to the bathroom, they are comfortable getting up in the night. And this is usually a subconscious kind of thing, but this is something that you can do to really help them. The other thing that you can do is ask your child if he's constipated. Now, no kid wants to be asked if he's constipated. Whenever I ask kids, I always say, I know you don't want me to ask this, but it's really important for me to know. And if they don't know what constipation is, tell them what it is. You know, a lot of times we'll say to our 5-year-old, are you constipated? And they look at you and go, no, yes, no. They don't know what you're talking about. So tell them what it is, even if they're 7 or 9.
You know, many professionals invest in an executive coach for personal development and a trainer for physical fitness. Now you can hire me, a best-selling author and expert coach, to help you raise great kids. I've over 35 years practicing pediatrics and an extensive experience decoding what your kids need and think about you. I've helped countless parents just like you. You can talk directly with me through private or group coaching. I'll listen and provide a customized plan to help you be the best dad you can be. Sign up now through the link in the episode notes. Your kids are counting on you. Let's make your family's future brighter together. Some days, parenting feels like chasing moments that never quite land. You ask a question, they shrug. You try again, they look at their screen. And you wonder, why is this so hard? That's why I love FamGabs. It's a 70-card deck created by a child therapist who spent 16 years working directly with families, helping parents and kids break through the awkward one-word answers and really connect. The questions are open-ended, thoughtfully chosen, and designed to get your child talking and keep the conversation going. There are even bonus cards just for parents to help you build your confidence in your connection toolbox. If you've ever wished for a better way to understand your child or just to have more meaningful conversations as a family, FamGabs is such a gift. Search FamGabs on Amazon and use promo code Dr. Meg Pod during checkout to get 10% off your order. That's FamGabs on Amazon. Use promo code Dr. Meg Pod and get 10% off your order. I've had so many parents say, Dr. Meg, my child is bright, but they're struggling in school and I don't know what to do. If that sounds familiar, you're not alone. And that's why I'm excited to share K-12 powered schools with you. K-12 offers tuition-free, accredited online public education for grades K through 12. These programs let kids learn at their own pace with built-in flexibility that supports different learning styles and family needs. And unlike homeschooling, K-12 provides certified teachers who guide your child's education online. The lessons are engaging, the technology is hands-on, and your child gets real opportunities to connect with clubs, extracurriculars, and even in-person events. As a mom, a grandmother, and a pediatrician, I know how powerful it is when education meets your child's needs instead of the other way around. So if you're looking for something different, something better, go to k12.com/Dr. Meg and find a tuition-free K-12 powered school near you. That's k12.com/DRMEG, all caps.
The other thing you can do, ask a very important question. Does it ever hurt when you poop? Because when kids have constipation and they push to get a bowel movement out, it can hurt. And if kids hurt once during one time they're having a bowel movement, they'll start to hold their poop in. It only takes one painful experience and they'll feel the urge to poop and they'll go, no, we're not going to do that. And so they start to hold their bowel movement. Also, some kids don't want to poop at school. So I always ask kids, do you poop at school or just at home? Because if they won't poop at school because they're embarrassed or whatever, they'll hold their bowels. And so they will become constipated with that. If your child is constipated and they're having hard poops, then you need to talk to your doctor about giving them stool softeners. Don't give them something that's going to go into their bloodstream like magnesium or any kind of medicine. Give them a stool softener like Miralax or Citracel that acts to pull water into the bowels and push everything out. Make sure they drink a lot of water, because if you give them a bulk agent and you don't give them water, it's going to be like concrete in their bowels. So don't do that. So think about constipation. Now, as your child gets older, if they're really embarrassed to go to a friend's house or, cousin's house or grandparents' house overnight, there is medication that we pediatricians can give your child that will help their body hold on to water. And that's a normal hormone that's in his body already, and it's called DDAVP or vasopressin. It is a hormone that works in the kidneys and says, nope, don't get rid of water. Don't get rid of water. That is one of them. Easy to take. It works for a day. It'll keep him from peeing in the bed and he'll feel a lot better. There are other medications that you can use that I don't like. But I don't want to speak against your pediatrician. Talk to your pediatrician about it. One is called imipramine and the other are a class of drugs called anticholinergics. Again, those can have different side effects. Talk them through with your doctor, and if it's going to help your child, consider it. They all work in different ways. A lot of people ask about bed monitors. Should I put a bed monitor that will, where an alarm will ring when water is detected on the bed? Usually you don't start to think about it until kids are about age 7. Okay. About 50% of the time they work. 50% of the time they don't work. And a mechanism of action, again, is once the child starts to pee, the sensor senses moisture and the alarm rings. Now, if a child is a really deep sleeper, the alarm's not going to do anything. But if they're not that deep of a sleeper, it may really help them. It's worth a try, because you really want to pull out all the stops for your child, because you don't want them to live with embarrassment. And then finally, put a pull-up on them. A lot of pull-ups now are made to be very absorbent, and they're very thin, and they act kind of like underwear. And when you give your child a pull-up, which I recommend you do if your child is wetting the bed more than 3 times a week. And it's, and it's not only hard for you to keep washing sheets, it's hard for them because they're constantly reminded they have a problem. And a wet bed in the morning says to your son, you've got a problem. And other kids don't do it, which isn't true. I would put a pull-up on your son. Do not call it a diaper. Do not allow anyone to call it a diaper. It is not a diaper. It is a pull-up. And you need to call it that. Also, if the medications don't work, if he goes to a friend's house or grandma's house overnight, send a pull-up. He can go into the bathroom to put his pajamas on, put the pull-up on. Nobody will know it and nobody will see it. And tell them, if your friend asks about their bedwetting, just say, you know what? I talked to my mom and my dad about it, but get them to diffuse the question. There's no reason in the world they need to tell their friends. Okay. So that's really it in a nutshell. Remember, it's not their fault. Don't make them change their sheets. Make sure they don't feel blame. Don't rush them off to a psychiatrist. Take them to their doctor and talk about it, because your doctor needs to make sure there are no other things going along with it. Wake up your child before you go to bed and make them go to the bathroom. Even if they don't wake up, stand them over the toilet and make them go anyway. Check your child for constipation. That may be the problem. And if you get rid of that alone, then all will be well. Don't use laxatives. I don't like using suppositories unless you are up against a wall. Use bulk agents and make sure they drink a lot of water so that they don't have concrete in their bowels. And finally, get an alarm if you think that your child may respond to that, because that can really help. That's bedwetting. If your child is doing it, don't freak out. It's not going to last forever. Check your family history and follow some of these tips because they really do work. Thanks so much for joining me. I love doing this. Send me your questions and I will try to answer them on my next Ask Dr. Meg episode. Thanks. Have a great day.